In other news, maternal mortality is a major contributor to a high number of deaths among women in Nigeria. Conservative estimates show that about 80 out of 10,000 women die during labor, an unacceptable rate in a nation so richly endowed with both material and human resources needed to combat these challenges. Our next report looks at the situation in Kaduna State and efforts by the state government to address the problem.
Although some harmful practices and traditional beliefs have contributed a great deal to the high rate of maternal deaths, the problem is compounded by lack of qualitative health services, poor road network, and death of medical personnel, especially in the rural areas. Other causes include hypertension, infections, malaria, and stress.
If I saw a friend that doesn't come to antenatal, I normally told them they should come because they doesn't know their health and the children health. The baby is their body. So apart from even your own, the baby own is more important than your own. If your baby is not lying well, they will tell you and they will give you time to go and do scan. From there you know if your line of your baby is proper, they will tell you it's very good for a woman to come to antenatal.
At a media sensitization forum on maternal health accountability held in Kaduna recently, a professor of obstetrics and gynecology at Ahmadu Bello University, Zaria, Professor Oladipo Shitu, attributed the high mortality rate in the state to man-made and natural factors, which, he said, are avoidable.
You see, right now, we still have a sizable number of women who don't come for antenatal care. I can't give you a specific number in Kaduna State. We still have a sizable proportion of women who don't avail themselves of skilled birth attendant at childbirth. All those women expose themselves unnecessarily to dangers and hazards of pregnancy and childbirth.
The Kaduna State government, through its free medical care for pregnant women and children below 5 years, says it is working tirelessly to address the situation.
The need assessment has been done in the state too. We are employing about 750 medical workers, all in efforts to combat this maternal mortality and then the child mortality in the state. We have been able to establish a very good referral system with the local government, whereby in a primary health care clinic, whereby they cannot do some of the major procedures, with the emergency transfer scheme by the wife of the governor, patients can easily be moved from one point to the next, where intervention is given almost immediately.
Despite the government's good intention, lack of legal framework to enhance its efficiency has remained a major challenge. And in order to reduce the high rates of such deaths, medical experts say access to maternal health services in Kaduna State should be for all women who require such, while a community health insurance scheme should be put in place by the state government to ensure that funding for health services is never in short supply. Also, the level of awareness of the rural dwellers needs to be raised concerning available health services in order to increase the utilization of such services.